Hello and welcome to this short presentation about Point of Contact, a serious game for COVID-19 preventive measures. This work is largely a team effort by master students from Lancaster University. The journey of Point of Contact started during a GCRF sandpit in 2017. A participant said that science behind the infection can be difficult to communicate in the context of the natural surroundings of the general public. A serious game could be an answer, but the idea stayed dormant due to various reasons. The comment found renewed interest with the COVID-19 pandemic. We looked at the use of a serious game more carefully, breaking down the challenges related to designing such a game. Prior research suggested that game transfer phenomena could work, but we needed to quantify it somehow. We also needed a realistic approach to model the spread of an infection. We wanted to see if modifying an existing game allowed us to observe the behavior related to game transfer phenomena while flattening the learning curve. The result of the brainstorming discussions was Point of Contact. The gameplay is fairly simple. 4 to 7 players play as office workers, completing tasks that build towards the team's economic score. One player acts as patient zero and arrives infected with COVID. This player can infect others through close contact with players and interacting with tasks. Other players can reduce the chances of getting infected by enacting preventive measures. At the end of the game, the players see their team's economic score versus their health score. The infection mechanics is intended to mimic real-world disease behavior. Close contact with infected avatars and contaminated objects can pass on the infection. Players have to interact in cramped workspaces, increasing transmission risk. The infected players may or may not display symptoms. Finally, the testing resources are limited as in the real world. The preventive measures are voluntary actions which reduce the risk of infection. These are modeled after the UK government guidance as hands, face, and space. These actions reduce the chances of infection. To model the real-world ambiguity of how the disease spreads, not every interaction will result in infection, rather relying on a probabilistic model. We ran a user study to see how players behaved during the gameplay. We found that the players underestimated the risk of infection and overestimated the precautions they took. However, we also saw a change in perception, a clear sign of game transfer phenomena from the comments as well as the in-game behavior. The subsequent iterations of gameplay showed more cautious behavior and increased number of preventive measure tasks being performed. The most interesting result was related to the opinion as to what was more important, protecting lives or protecting economic activity. The pre-study view was balanced towards both, but the post-study view was skewed towards protecting lives. We recommend reading the paper for an in-depth discussion on the game design, results of the study, and future directions. Thank you for listening.